Priyanka, can you get me some water please? Damn thirsty here.
Yeah, coming. Yeah, here it is.
Thank you.
You look so tired, Arvind. Is everything alright?
Give me a break, Priyanka. I'll tell you later. Are the kids done with the dinner?
Yeah, they did. Already sleeping.
And what about you?
No, waiting for you.
Priyanka, how many times I have to tell you? Don't wait for me when I'm late. You will never listen to me.
Don't worry, Arvind. After I returned from office, I had whatever was left over in the morning. Now you go get freshen up. I'll arrange for our dinner.
Okay.
Arvind, you had been to hospital to see Vimla, right? How is she doing? What happened to her?
She seems to be okay, Priyanka. But what I heard is quite disturbing. In fact, very serious also. I couldn't see Shankar with those two little kids in the hospital.
Is it? What is so disturbing, Arvind? What did doctors say?
Breast cancer.
My God, she's got breast cancer? I just can't believe this. She sounded so well when I spoke to her last week on phone. How can she be so serious suddenly? And I've heard it can be cured these days.
You're right. But doctor says she has approached very late for the treatment.
What? But I've heard it can be cured with the advanced treatments available these days. Why can't we get Vimla treated with these treatments and save her?
Maybe we can. But the irony is, it is curable if it is detected early and it can be treated in the early stages only. You know what? This breast cancer is very silent in the initial stages.
How on earth Vimla could have found it in early stages? And how can these doctors expect her to go to them in early stages? Are you sure you heard it right, Arvind? Maybe we should get a second opinion.
We did that also, Priyanka. But we got the same opinion. In fact, doctors are planning to remove her entire breast in the operation tomorrow.
Oh my God. Poor Vimla. She's losing her whole breast and still have no hopes of survival. But how could she figure it out in early stages when she had no pain or growth?
Yeah, even I had the same question. But I managed to find the answer while Shankar was doing the formalities for tomorrow's operation. I met a person in the hospital. His wife also having cancer. And now she is completely cured. You know how? They have managed to report to the hospital in the early stages. With a short medication, she is completely alright now.
But how did she find it in early stages when she had no growth or pain?
I don't know. But he was referring to some self-examination that his wife was doing regularly. In fact, that has helped them to find it out very early stage itself.
Oh, really? At home? Herself? Amazing. But how is it possible? Is it so easy? Unbelievable.
Yes, it is not so difficult at all. But it has to be done every month regularly. Priyanka, at least now you have to listen to me. You must get onto it now itself.
Stop it, Arvind. You're scaring me now.
See, because of this self-negligence only, Vimala is fighting for her life now.
Come on, Arvind. If Vimla gets it, that doesn't mean everyone will get it. And how can you expect me to do all this when I'm already struggling to juggle with things between office, home and these kids? It's already getting into my nerves.
Listen, Priyanka, these things may not come with a warning. Unless we are cautious about ourselves, we may get into big problems like this even without our knowledge. It hardly takes 15 minutes. Can't you spare 15 minutes in a month to protect yourself from all this?
Yes, you're right, Arvind. I had lost my sense. But how do I do it? I don't know to do self-examination.
Don't worry. We must thank this gentleman. In fact, he sent me a video of then and there, which very clearly explains the self-examination method.
Sir?
It very clearly explains how to do the self-examination.
Definitely, Arvind. He deserves a lot more thanks for his intention to help strangers like us. By the way, how did he know about it and we don't know it till now?
It seems every October is considered Pinktober by every hospitals and clinics to increase the awareness on breast cancer. This couple, no? Luckily, they have attended one of this event organized by Dr. GVG Breast Care Clinic. Then onwards, they are very active in this,
Oh, then I should thank him even more, Arvind, for his help. If he had not shared his video, then I had to wait till next October to learn self-examination, right? My God. Arvind, now I recall, my friend Geeta in my office was asking me to join her for Pinktober event last October. I just ignored it. I never knew the importance of this. If I had attended, maybe I could have saved Vimla from this. I was so ignorant.
Priyanka, don't you think we have been hearing these breast cancer cases very often nowadays?
Yes, Arvind. I'm really worried about my little daughter.
Yeah, even that gentleman was telling. There is also a doctor talking about breast cancer in the same video. Why don't we watch the video after our dinner?
Yeah, sure.
Okay, sir. No. I'll get your project done. Yes, sure. I'll put my entire team into it. Don't worry, sir. Okay, done. Thank you. Good night.
Arvind,
Yeah.
shall we look at the breast cancer awareness video which you have got? I'm very curious to know about the self-examination.
Give me a moment. I'll show it to you. Yeah, see.
Hi, my name is Dr. Gunashekar Palapati. I'm an aesthetic plastic surgeon. Today, I prefer to speak to you as a friend more than a doctor. With your awareness and help, I believe it is very much possible and feasible to save thousands and possibly millions of lives. Without any treatment or with minimal medical interventions. In your noble effort to save so many lives, we extend unconditional support and guidance to make this campaign as effective as how we eradicated polio and smallpox. Are you wondering how can we save lives? Is it not doctor's job? Well, some diseases are like that. Doctors can just treat them, but it's only you who can prevent it or at least save yourself from these diseases by reporting it early in time. That is possible only if you know what, when, and how. Amongst them, there is one disease which is affecting our society increasingly these days, causing slow and painful death to so many, that is breast cancer. We all know that it has taken so many lives, but what many of you don't know is that half of those who have lost their lives would have been alive if they had known what you're going to learn today. Moreover, it is even possible to prevent this dreaded disease altogether. Are you wondering how to prevent this? Firstly, if we can understand how is this disease caused, what is causing this disease, then we will know how to prevent this. If I have to put it in simple terms, our body's health is maintained by a continuous process of some cells dying and being replaced with some new cells of the same numbers. And this process of cell death is called programmed cell death, and the process of new cells forming is called controlled cell proliferation, and this is being controlled by some genes. If there is any problem with any of this gene, it leads to uncontrolled cell proliferation, leading to a growth of lump or cancer. The cancers that arise because of this defective genes has always been there, and it is probably not possible to prevent them. But the recent rise in the number of breast cancers and many other cancers is primarily due to unhealthy change in our lifestyle, diet, eating habits, environment, and some hormonal manipulations. This is where we can make a difference between life and death from this breast cancer. So, if we know what kind of changes in the lifestyle, diet, habits, and medications that make us more vulnerable for this disease, we can make every effort to make healthy change and stay away from this dreaded disease and save our future generation from this disease. If we analyze why this trend is not seen in our rural India as much as in urban India, we'll explain us why, what, and how. That is because of the traditional Indian lifestyle, balanced diet, which are rich in antioxidants like turmeric, organic food, unprocessed food, unlike in the cities. Now, coming to the most important part of this program is to note that more than 50% of the breast cancer victims in our country are dying from the disease within the 5 years of diagnosis. Whereas in the developed countries, it is less than 25% of people who are dying from this disease within the first 5 years. It does not mean, and it is not because we don't have good doctors, hospitals, and treatments, but it is because those affected people in those countries are trying to find out at home and report to the hospital and doctors early in the stage of breast cancer, that is curable stage of breast cancer, and get it cured completely. Are you wondering how they were able to detect early at home? Do you also want to learn how and be wise enough to save yourself from this even if you get this breast cancer? It is very easy. Just 15 minutes simple activity called breast self-examination. That's all. But you have to do it every month to save yourself. Shall we see how to do this self-examination, which has saved millions already and may save you and your dear ones?
The breast self-examination is an effective touch technique aiding in the early detection of breast cancer. It takes about 15 minutes to do and should become a monthly routine for every woman. Remember, breast cancer can be beaten especially when detected early. Breast self-examination works because it helps you notice changes in your breast from monthly examination to monthly examination. If at any time you feel discomfort from wearing bra or laying down, take the time and perform self-examination. Tender areas, soreness, or anything different should be noted and discussed with your doctor. Here is how to do a self-breast examination. Typically, breast swelling and tenderness occur before your period begins. Do not do a self-exam at this time because of these symptoms. Ideally, for women still menstruating, the 7th and 14th day is when you should do an exam. If you are not menstruating regularly or at all, you should perform an exam on a specific date. For example, the first day of the month. When performing a self-examination, you should be aware of any differences since your last exam. For example, changes in your breast or underarm areas, such as differences in texture, movement, lumps, or tender areas. It is our recommendation that prior to the beginning a regular routine of self-breast examination, visit your physician for an initial examination. This will provide you with a reference of what is normal for you. There are 3 parts to remember: a visual inspection while standing in front of the mirror, a hand check of your breast while standing, a hand check of your breast while laying down. First, the visual check. While standing in front of a mirror, examine each breast carefully. First, the frontal examination, then turn slowly side to side. If you have a large breast, use your opposite hand to lift each breast to examine the lower halves. Next, raise your arms over your head and behind your ears. First, a frontal examination, then turn slowly side to side. Once again, if you have a large breast, use your opposite hand to lift each breast to examine the lower halves. Finally, lower your arms with your hands level and in front of your foreheads. Then, squeeze your palms together. First, a frontal examination, then turn slowly side to side. You are looking for changes in size, contour, obvious lumps, dimpling, flattening, reddening, rashes, sores, nipple flattening, or your nipple pointing in the new direction. Next, a physical check of each breast while standing in front of the mirror. Remember to use the opposite hand to re-examine each breast with a flat hand using moderate pressure in small circles. Begin at the top part of your breast and move across. Move back and forth, following the straight line pattern, with each pass should be approximately 1 finger width down each time. Do not bend your wrist or fingers to follow the contour and maintain the constant contact. It is very important to check your underarm area. To do this, release your arm and place your hand under it. Using moderate pressure in small circles, examine the underarm area. Now do a hand check while laying down. Using a firm flat surface, repeat the same procedure as you did previously. Once again, remember to use the opposite hand to examine each breast. With the flat hand, using moderate pressure in small circles, begin at the top part of your breast and move across. Move back and forth following a straight line pattern, with each pass should be approximately 1 finger width down each time. Do not bend your wrist or fingers to follow the contour and maintain the constant contact. Now, re-examine the underarm area. This time, rise one arm above your head, then using moderate pressure in small circles, examine the underarm area. Move back and forth following a straight line pattern, with each pass should be approximately 1 finger width down each time. Do not bend your wrist or fingers to follow the contour and maintain the constant contact. You are checking for any differences since your last examination. Correctly doing the self-breast examination on regular basis is important in the early detection of breast cancer. If you do have any questions or concern, speak to your physician. Additional information can be obtained from your local cancer society.
Have you seen how easy and simple it is to do this breast self-examination at home? So now on, if you are a woman more than 30 years, or if you know of any woman who is more than 30 years, shall learn and perform this breast self-examination every month without fail. Failing which, you may fail in case if you do get breast cancer. In case if any of your family members are already affected with this breast cancer, you may have to start doing this physical examination as early as 20 years of your age. Well, a note for men who think it is a disease of women. This breast cancer can also affect men, amounting to as many as 3 men involved in 100 breast cancer victims. So it is very important all of us are vigilant and be aware of it. If you want to know more about this breast cancer, you can consult your doctor or contact your local cancer society or call Breast Care Helpline. Remember to forward this life-saving awareness video to all the adults you know of. It is a great opportunity to save so many lives. Be the first, be the hero. To save lives, you don't necessarily have to be a doctor. But if you report to the doctor in the late stage of breast cancer, it is very difficult even for the doctors to save you. So, will you forward this to all the mankind? do it. God bless. Thank you.
Wow. It is so easy to do self-examination. Arvind, I promise, I will be very regular. I will do this every month without fail. And I will let everyone know about this. I don't want anyone to suffer like Vimala.
Yes, Priyanka. We must share this video with as many as possible. And also you must request a lot of women to do the self-examination every month without fail. I think it should be made compulsory also. Then only we can save so many people dying out of this cancer.
Yeah, it is so much true and easy, isn't it? Arvind, doctor also mentioned about the traditional food habits. I'm going to follow that from now on. So, no junk food. Happy? He also mentioned that it is seen in 3 men in every 100 breast cancer cases. So, you better be careful.
Yes, the good diet habits can avoid all this kind of diseases. As doctor said, the factors which are influencing for the causes of breast cancer should be understood and dealt with from now onwards, so that our future generation should not suffer from this kind of ailments,
Absolutely. In fact, I'll start forwarding this video to everyone I know right away. Arvind, it is too late now. You better go to bed. Tomorrow early in the morning you have to go to the hospital to visit Vimala, right? Are you listening? Don't ignore this and don't let anybody be ignorant on this. Forward this self-learning, self-examination video to everyone you know right away and ensure you follow this religiously and regularly.